Hi, everyone. Welcome to today's presentation. I'm going to allow a couple seconds for everybody to get into today's meeting. For those of you who don't know me, my name is Dr. Brianne Callanan, and today I have the pleasure of facilitating a conversation with my colleague, Dr. Lori, on behalf of Health Buddha. And today we are going to be diving into all things hormones, hormone-related concerns, testing, lifestyle, what you can do about it, what are some common symptoms that may not be normal, even though we have displayed them as common in our society. A couple housekeeping items. Today's meeting will be about 20 minutes long, and there's going to be room for a Q&A at the end. So if you do have questions, I would encourage you to find the chat box right now, type your questions in as we go, and we will definitely get to them at the end. So thank you everybody for joining. If you could turn your microphones off as you come in, that would be really helpful. And let's get started. So today I have Dr. Lori joining the conversation. Dr. Lori, tell me a little bit about yourself.
Hi, Dr. Brianne. Hi, everyone. Thank you for joining. I'm really excited to be here. So my main focus in practice, I'm a naturopathic doctor that focuses on cancer care, but I see people usually when they've had hormone imbalances for many, many years, they let it go, not knowing that there's things that you can do, whether it's naturally or just things that we can support the body with to balance. So when I see people having cancer with these hormone imbalances after so long, I think, I'd love to get a hold of their hormones and help understand so they can make these changes before it gets to that point. So I'm really excited that everyone's here to learn more about your hormones, or if it's for a loved one, so then we can kind of walk you through the steps on what you can do to be more balanced and more proactive.
And I love that you said some of these things that we've brushed off as common, right? Or we brush them off as normal because they are so common. Can you expand a little bit on that? What are some of the main things that you see people kind of dismissing as just a part of being a female?
Yeah, it's so interesting because, as you know, like when we see patients in clinic, we'll have them fill out an intake form and say like, okay, these are my main issues. And then when you start talking about like, okay, the week before your period, like, what about this? What about this? And they're like, oh yeah, there's that too. Oh yeah, and I get these like deathly cramps where I have to call in sick for work. Oh yeah, but then I will like want to break up with my husband every month, like around that time. But they don't really put that on the intake form. They just say like, oh yeah, that's just like part of my hormones. It's always been like that. I didn't want to go on birth control for it or whatever the reason was. And they just accepted it. So it wasn't even like a concern for them, which to me means they just accepted it. And that's just part of being a female. You have to deal with these really shitty issues every single month. So that is what I see as like, oh, that should not be the norm. That is not something that we should all have to endure. We know it can affect your own life, other people's lives. It can affect your work, your focus, your family members, your loved ones. So it is a really important topic to know that, okay, this is not normal. It's very common, but it's not something that you have to live with for the rest of, or until you hit menopause, essentially.
And what would a typical cycle look like? Like, is it normal to feel a little bit tired before your cycle? Or at what point do we say, okay, symptom X, Y, and Z leads to some further investigation?
Yeah, that's a good question because it's like, what is normal then, right? During the different phases, so there's the follicular phase at the very beginning of the cycle, then there's the luteal phase, which is like right in the middle where estrogen is peaking, and then the ovulation phase right in the middle, and then the luteal phase right before you actually would get your period. So it's common for women to not even be in tune with those cycles and like how our hormones are changing, and think that we have to just like go throughout the month, push ourselves, work hard, exercise, like do all the things. Even when it comes to like fasting protocols and how you're eating, we think that we should just be doing all the things all the time. However, the week before your period, that is a time where you can just like sit back a little bit more. Like you have that permission just to relax and allow your body to regenerate and to recuperate. So to say like, okay, I'm so tired the week before your period, that may be a sign to say like, maybe that's good just to take a nap if you need to, or you need the extra hour of sleep. Like that's totally fine to do that. And same with like, if you get more agitated or more anxious the week before your period, there's things we can do. But if it's just like a minor issue, like maybe that's another flag there to say like, okay, you can just like step back and relax a little bit more.
So that week before your cycle, would you also scale back on some of the nutritional strategies that you're utilizing or your exercise, like just do more restorative, regenerative type exercises?
Absolutely. Like you think about, I'm a huge fan of fasting. So for many reasons, like before chemo, for weight loss, for hormone balancing. However, if you are fasting the week before your period, your body can sense that as possibly another stress. So fasting is a stress on the system. So if you're trying to do like a 3-day fast right before your period, you're just going to feel awful. So that week before, you maybe just don't hit the gym as hard. Like you're not going to do things as intense that are going to get cortisol going, more inflammation going. You want more, even like complex carbs. You want to really like do gentle yoga or stretching, meditation, like do more of the grounding exercises and routines versus like pushing yourself so hard for that week.
And I think that's a really important point for a lot of females to recognize, because male hormones will change throughout the day, but from Monday the same, whereas females have very big differences at the start of the cycle versus the end. So many women try to do the exact same thing throughout the cycle when it comes to their nutrition and their health habits and their exercise. And then when it doesn't go as well and they're not seeing the results, especially before their period, or it just feels like you're really struggling during that time, it makes sense, right? We have to honor where those hormone changes are and manipulate what we're doing so that we can see the positive results over time.
Exactly. And our cycle, it's so interesting because if you were just to like push it hard in that one week, even though you're like, oh, I don't feel like going to the gym, I don't want to do this intense boot camp, but you push yourself anyways because you think you'll feel guilty if you don't. That next cycle, your cortisol is going to be way out of whack. The way you're dealing with stress, you may be reaching for different foods just to kind of like keep your energy going. So it allows this whole cascade of hormonal imbalances versus just saying like, you know what, this is where I am in my cycle. And it's okay that I don't, push myself to that degree.
And I see that, and I've had personal experience with that as well. Like it'd be really intense, really great. And then all of a sudden I couldn't maintain it and it went the opposite way. But at the end of the day, you're really not seeing any progress, right? You might as well do things that help support your body so that you are seeing that momentum over time.
Exactly. And those are the times when you would tend to find more cravings as well. So you would say like, oh, I just want to have like a bag of chips for dinner, or like have carbs, or like the quick things to fuel your system without realizing that you haven't been nourishing your body the right way. So you're reaching for this quick fix and having these cravings that are just going to make your system like more off balance down the road.
Now, if this is resonating with individuals or like, yes, this is me, where would they start? Like, where do we start? Is it testing? What's the next step?
Yeah, there's a lot of common trends. Like usually when people have a hormone imbalance, you can just buy a thorough intake with a naturopath. You can say, okay, the week before I have more cravings, I'm more tired, I'm more irritable. Like there's a whole cascade of things. So a naturopath can put you on a very, on a good plan based on that, but you don't really know the full story of what's going on in your hormone balance, like the whys it's like that until you test it. So I know you're a big fan of the Dutch hormone testing, and so am I. You can't just look in blood work for your hormones. It's going to give you a totally different picture versus more of a clinical picture when you get hormones checked through urine metabolites. And then you can also see, like, is it estrogen that's the issue, or is it because your body's not producing any progesterone? If you're low in progesterone, you're also going to feel like the fibrocystic breasts, maybe fibroids, you get really heavy period, just so tired or more anxious, maybe you have sleep problems. The other thing that progesterone does is it down regulates your histamine response. So a lot of people have, if they're low in progesterone, they can have a lot more allergies. So all of it's connected. So really to understand like the full understanding of where progesterone is, testosterone, even if your testosterone's low, you can feel depressed and like no motivation to do anything, hard to put on muscle. So thorough testing, I am a huge fan of. I usually like for the first month say like, okay, there's a lot of cleaning up we can do and just change your diet, change your lifestyle. But then if nothing really shifts after that 1 month, like we need to test. Like it's just, there's no other way of really knowing. And then even cortisol too, right? To see what your trends are when it comes to how your body is dealing with those stressors. We want to know, like, does it peak in the morning? Are you completely flatlined and burnt out? Is your cortisol through the roof? And we need to do other herbs or other things to help balance that. So testing is by far the most personalized way that you can support your hormones.
And one of the great parts about the Dutch testing for individuals who don't know what this is a urine-based test that you can do at home. And you can also provide the urine samples throughout the day so we get an overall reflection of how the cortisol is doing. Cortisol is your stress hormone that follows a curve. So if you just test in the morning, it's hard to get an idea of what is going on overnight, what is going on in the afternoon. And when we're looking at the overall risk for cancers, like you do a lot of focus on in your practice, knowing how the estrogen is broken down is important for overall risk of cancer. Can you talk a little bit about that?
Yeah, that's huge. That's such a big thing because even if your estrogen is looking normal on all of the tests, it doesn't mean that you're breaking it down. The metabolites are breaking down in a safe and healthy way. So there's three main types of the way the estrogen breaks down. So you've got the 2-hydroxy, the 4-hydroxy, and the 16-hydroxy. 99% of the people that I see with cancer have really high of the 4-hydroxy and the 16. And that's an issue because those estrogens, they stimulate cell growth. So whether that is from fibrocystic breasts, endometriosis, having fibroids, and then all the hormonal cancers. So breast, cervical, endometrial, even colon cancer, prostate. So for men too, like breast cancer, colon cancers, prostate cancer, all of those are because your body is not breaking down those estrogens properly. And I even see that with women who are on like letrozole or aromatase inhibitors, where they're blocking how the body is converting the estrogens. They can still have these metabolites that are not balanced. So this test is such a great way to understand the whole pathway of where things could be off. The test also looks at methylation. So if you're even like converting it into a safer form, if you're not, that can affect the DNA and turn on these cancerous genes as well. So from an anti-cancer standpoint, but then also just understanding like why you feel so irritable the week before you're like, it can go from a range from being an acute monthly day-to-day thing to like down the road, you're saving yourself from being more predisposed to certain types of more chronic diseases such as cancer. So the other thing I really like about this test too, which gives me tons of information, is the looking at oxidative stress. So it can tell like how inflamed your body is too. So that inflammation can absolutely turn hormones upside down. So getting the full picture of like, is it adrenal, a cortisol issue? Is it a hormone metabolite issue? Is it a methylation or oxidative stress? So yeah, it's a very great test to look at the whole picture there.
Overall. And it can be helpful as well, looking at who may or may not be a good candidate for hormone replacement therapy, or if you are choosing to go on hormone replacement therapy or bioidentical hormones, we can predict, looking at these pathways, okay, if we do this, what will happen? How will they actually be metabolized and utilized by the body? Because no two individuals really respond the exact same way to different treatments. So this can be insightful too.
Absolutely. And even I see a lot of men taking like testosterone and thinking like totally fine, like, you know, I have all the symptoms of low testosterone, but then you see the hormones that it's going like shuttling right into that estrogen pathway. So we could see like where exactly in that curve that we need to support the body and to make those hormones convert to the other one, or even to like prevent how those hormones are going into that pathway. So yeah, it's a really, really great test.
And a couple of common pictures that we might see in individuals who are having some of these PMS type symptoms. It could be, you know, an estrogen dominance or progesterone deficiency. What are some lifestyle factors or nutrition things that individuals can do to help maybe bring this a little bit back into balance, just to, you know, to get them started?
Yeah. So one thing that I would say, so since we know stress plays a huge role in how our hormones are being produced or how it can throw it off, I would say getting enough sleep every night, like that should be your number one. If you're not getting a solid night's sleep, you want to fix that first. So whether that is like getting off of screens, I know it's a very hard thing to do, but getting off screens, I know Dr. Brianna texts each other very late, so I should, I'm one to talk there, but maybe putting on blue light blocking glasses. So then you're affecting your melatonin production. So that whole circadian rhythm is a really important thing to look at when looking at hormone balance. So trying to get your room completely black, like you shouldn't even see your hand at night. Like it should be completely a black room. And then staying away from stimulants. If you have any sleep issues, you want to be getting rid of the things that give you that immediate bump, and then you just have a crash later. So cortisol and stress and sleep play a huge role in how we're balancing estrogen and progesterone. So sleep would be top. There's anything I'm missing there? Getting your sleep in,
Sleep, manage your stress.
Yeah, stress. And then also there's certain foods that we know besides from caffeine that will stimulate more of an estrogenic or a higher insulin picture. So things that like cause cells to replicate more. So dairy is one of them, high sugar diets, alcohol, and sometimes people react to wheat as well. So those are things that you want. If you have a lot of those into your diet now, start to switch to more nut-based milks or having sugar-free things, like really cutting back on those. And if you realize like, okay, the week before my period, all I want is sugar, then maybe that's where you have to look at your meal plans and say like, okay, let's bump up how much protein I'm having in that week, have more fats. You want to aim for at least 30 grams of fiber, things to really fill you up, because those sugar cravings may just be because your hormones are so imbalanced and you're craving that quick fix. So if you can supply your body with those nutrients, it'll help prevent that cascade of cravings as well.
And what are your thoughts on cruciferous vegetables? Is that something that can be helpful?
That's a huge part of how your liver is metabolizing hormones. So if you are steaming all of them, like the Brussels sprouts, the cauliflower, broccoli, if you are like, oh, I don't like any of those cruciferous vegetables, then you should look into something like DIM or indole 3-carbinol, like look into a supplement, ask your integrative doctor if that is something that you should be taking. The cruciferous vegetables, there's so many studies on that from an anti-cancer, but also from a hormone imbalance. Another thing that I really like to do, and I tell a lot of women who have hormone imbalances, especially PMS, is look into coffee enemas. It's a really great way to take stress off the liver. I find even for their next cycle, they're like, I didn't get the breast tenderness that I usually get. I didn't get the cramping, and I didn't think I would love them, but I love them. So doing coffee enemas sound like this big terrifying thing. And like, which is weird, right? For most people. But what it does, the coffee going into the hepatic portal vein, it helps with your liver and how it's metabolizing, similar to almost like what cruciferous vegetables would do, like helping metabolize estrogens, and also really great for bringing down inflammation in the body. So going on to a plan where we know like how often you should be doing them, when you should be doing them, coffee enemas, I find are just like a really quick way to get your body back into working more balanced.
And that would make sense too, right? Because we're having so much more exposure to exogenous or environmental exposures of estrogens. We're having more exposures to toxins in general. So our liver becomes overburdened. So yes, the liver's primary role is to detoxify, and it does that on an ongoing basis. But when you overburden a system, that's where we might need to consider some additional support. So to summarize, it's really important to sleep, manage your stress, cruciferous vegetables each and every day, like broccoli, kale, cauliflower, bok choy. Broccoli sprouts are another one that's really great. What about water? What type of water should individuals be drinking?
Yeah, so I mean, I don't think anyone drinks enough, for one. People don't drink enough water. So if you were to get the source of water you should have, if you were to have completely filtered, you're not getting a lot of the minerals that your body needs. So it can even lead to further dehydration if it was completely filtered of everything. I like the ones that are reverse osmosis with the minerals put back in. Then you know that you're getting rid of a lot of like molds or chemicals or things that are just in
Fluoride,
water.
chlorine.
Yeah, exactly. And so I've seen where even like the Brita filters or the ones with the carbon, like they're very prone to mold. So you would have to change those every single week if that is the system that you're using. So getting an in-home system, and even you can get a lot of metals from your shower too. So making sure you're putting a filter on that, or like when you're having a bath, you're soaking in this water that could potentially have heavy metals, which further throw off more stress on your liver, throw off hormones. So yeah, getting a great filter, and then for drinking water, making sure that it's remineralized as well.
Amazing. Okay, we do have a number of questions here, so I'd like to dive into the questions. Individuals, if you still have more questions, please post them. And we're also going to be sharing links to Dr. Lori's Instagram, which is a huge wealth of knowledge for you to follow her as well. Now, this is a common question. How do you manage bioidentical hormone replacement with the Dutch testing? Because it does take a number of weeks to get this results back. So is it you kind of start with the Dutch testing to see how the hormones are, how they're metabolized, and use blood work for monitoring, or what do you do in your practice?
Yeah, exactly. So if you're on bioidenticals and you're wondering, like, is it fixing the problem? Like, are my hormones still off? Because most people, when they go on bioidenticals, they do feel a lot better. So they may not have the urgency to test, but you would always interpret the results knowing that you're on that test. So for example, if you're taking high dose progesterone or the creams, and then you do the test, you can say like, okay, where is that pathway shuttling into, and what are the results based on knowing those results? The bioidentical, like the creams, only last in your body. They have a 12-hour lifespan, so that's why they say like every 12 hours you need to apply them. So you could, if it's not something you're totally dependent on doing, you could stop them for a week and then test. So it's
To
something
see
you
where
can
the baseline is.
exactly. And I would prefer that, because a lot of times people are given bioidenticals without testing, and they say, oh, it sounds like your symptoms are for this, but maybe they've been on it for too long. They become more resistant to it. Better just to get a very clean baseline without those other markers.
Okay. Now, progesterone deficiencies often come from individuals who have too much stress, they're not ovulating. What is the recommendation? Like, you can do bioidentical hormones, but you can also encourage ovulation. Is that right?
Yeah. So sorry, what was the question? If there's a progesterone deficiency,
Yeah, like where would that
you
come
can
from?
do?
And then what is some of the things that you could do?
Yeah. So one thing that really affects the balance of estrogen and progesterone is our gut. So
Mhm.
gut health and our microbiome. So we have what's called estrobolome, like how our body's like breaking up the bacteria, is how it's breaking up the hormones. So sometimes it's not really a progesterone deficiency. It's because your body is so high in these estrogen metabolites, and so it just kind of like throws that scale off. But if it is a true progesterone deficiency and they know that, like it's something that they've tested and they're low in, you would want to focus more on like root vegetables, like have vegetables that are just a little bit higher in starch. So someone who's progesterone deficient, you don't want to be like fasting for too long. You want to think of it as more like nourishing things that your body needs, not so much like go or fasting or depriving yourself of certain things. So more of like the root vegetables, and then healthy fats are a big one too. So avocado, dump on like olive oil and everything, coconut oil. A lot of the healthy fats will help with progesterone production as well.
Production. Amazing. And another great question regarding the coffee enemas. How often should that be done?
Such a personal journey for a lot of people. I know in the clinic when we run retreats and there's a lot of stuff going on where patients are just exhausted and they feel like they've had these chronic issues for so long. We would do them every day. Coffee enemas every single day. And you want to look at coffee or as enemas are like two different things. So the one is coffee is more detoxing, helping liver, helping just like get rid of anything that could be sitting more in the sigmoid colon or in the gut. And then there's other enemas that are more nutritive as well. So you could do like probiotics into an enema. You can put an aloe vera. You could do more of things that are like retention enemas. So I always with patients try to balance it out. So not just doing coffee all the time. At the beginning, to fix a hormone imbalance, you may want to do them like twice a week, 2 to 3 times a week, and then you can taper off. So when it's very responsive, I find, when you do them. So you could even go down to like once a week. Personally, I do them once a month just because I feel like that's all I need. So it's really a personalized thing, like what the issue is, how long it's been, if it's more of an acute issue. And I feel like that would even answer the next question about the hormonal acne too, right? Balancing coffee enemas are a great thing for that too.
And is hormone related acne always related to one type of hormone, or what types of pictures that you might see there?
Yeah, so we always think of acne as more of like estrogen or too much testosterone, like the androgens just aren't being metabolized properly. So hormonal acne, you would see just around like the week before your period, and it's usually just like around the jawline too.
Mhm.
But it's interesting because people who have those outbreaks every single month, they'll also notice, oh, that week before I just like binged on carbs and chocolate and all those things because they didn't give a shit. They didn't care. And then that's when those outbreaks would happen. So it really is like the whole picture there, looking at your liver health, how your body is metabolizing these hormones, what foods you're putting in. If you find that you're just more anxious and irritable the week before your period, and that's when the hormones, the acne starts to break out too, then you want to focus more on sleep, looking at progesterone. It really is about that whole big picture there.
I think we have time for a couple more questions here. This one is really interesting, looking at, okay, if we're doing fasting or we're doing a lower carbohydrate approach to address insulin resistance, but that is causing some of the low blood sugar symptoms, how would you go about managing that?
Yeah. So our body is so intelligent. You think about like if you're taking away one food source, so one like sugars, for example, and glucose, your system's going to kick into this other source of fuel called ketosis. So it's going to take your own body fat and create ketones out of it. And so usually if you're like cutting back on sugars too low and you feel all these like mood swings, you feel hangry, all those symptoms, it's likely because you're not producing ketones. And there's many reasons why you may not be producing ketones. If you're not metabolizing fat properly, like if you can't, even if you're taking in lots of healthy fat and you have more weight to lose, then we would want to support how your body is going into ketosis, because we've seen where you can fast for like a week and feel amazing, feel so good because your body's kicked into that. So if you're finding like you're cutting back on certain foods and you have this like transition that you just feel awful, look into how to fast properly and how to kind of like transition the system, because there's things you can do to help break up fat more effectively to provide that extra fuel source when
Types
you're
of
cutting back.
nutrient stimulation, liver support, etc. Yeah. All right. Now, thank you so much for joining. I think that was really informative. There was lots of really great questions in the links or in the comments or the chats. You can find links to Dr. Lori's Instagram if you'd like to book an appointment with her. Follow along on Instagram with Dr. Lori as well as Health Buddha, because we will be posting more information about upcoming presentations and different resources for each and every one of you. So I thank you everybody for joining. I feel like we could dive in and keep going all day with this conversation, but I appreciate your time, Dr. Lori, and thank you for everybody that joined. And I hope you all have a wonderful rest of your day.
Amazing. Thank you, everyone. Bye.